Hi everyone, I'm Dr. Sherry, Chief Medical Officer of Women's Health at QuickMD. Today we're focusing on a medication that often raises a lot of questions, and that's Norethindrone. If you're using systemic estrogen therapy or have been told you need something to protect your uterus, there's a good chance Norethindrone has come up. In this video, I want to slow things down and explain what Norethindrone actually is, why it's commonly used in hormone therapy, how it works in the body, what benefits it provides, and how to use it safely. Most importantly, I want to clear up some of the fear and confusion around progestins, because Norethindrone isn't added randomly or without purpose. It plays a very specific and important role in making estrogen therapy safer. So let's start with the basics. Norethindrone is a progestin. Progestins are synthetic forms of progesterone, not bioidentical, that are designed to act on progesterone receptors in the body. That doesn't make it bad or unsafe. It simply means it's structurally different and behaves a bit differently in the body. In hormone therapy, norethindrones primarily act to protect the uterus. This matters because estrogen stimulates the lining of the uterus, or the endometrium, to grow. Now that's normal during reproductive years when progesterone rises and falls naturally during the menstrual cycle. But during menopause, your body is no longer producing progesterone consistently. That's where norethindrone comes in. It balances estrogen's effect on the uterine lining and lowers the risk of endometrial hyperplasia and endometrial cancer. This is why norethindrone is included in many combination estrogen pills and sometimes prescribed separately alongside estrogen patches or gels. For many women, norethindrone is safe for long-term use. It's been widely studied and used for decades in both reproductive and menopausal care. A very common myth is norethindrone is just birth control. While norethindrone is used in some contraceptives, the doses and goals in hormone therapy are completely different. The most important benefit in norethindrone is uterine protection. If you have a uterus and take systemic estrogen, some form of progesterone or progestin is essential. Now, beyond uterine protection, norethindrone can also help with more stable hormone levels, reduce risk of abnormal uterine bleeding, and better tolerance of estrogen therapy. Some women also notice improvements in sleep, mood stability, and fewer estrogen-related side effects. That said, norethindrone is not meant to treat menopausal symptoms on its own. It has a much more supportive role. What it does is to allow estrogen therapy to do its job more safely. Norethindrone is most often recommended for women who are using systemic estrogen, still have a uterus, or prefer oral combination therapy. It's commonly used in perimenopausal women when bleeding patterns are unpredictable and estrogen levels fluctuate. I've been asked if norethindrone will help regulate bleeding, and the answer is yes. In perimenopause especially, norethindrone can help reduce irregular or heavy bleeding. In the first few months, some women will experience spotting, and it's very common as the uterus is adjusting. But over time, uterine bleeding becomes lighter, more predictable, and stops altogether. Norethindrone can be taken in a few different ways depending on your treatment plan. It may be combined with estrogen in one pill or prescribed separately alongside estrogen pills, patches, or gels. Most regimens involve daily dosing. Doses used in hormone therapy are much lower than the ones used in contraception. Your dose depends on your estrogen dose, your bleeding pattern, and your tolerance. If bleeding or side effects occur, doses can often be adjusted to better support you. Now, a question I hear when prescribing norethindrone is, do I still need progesterone if I take norethindrone? And the answer is no. You don't need to take both unless specifically directed to do so. Norethindrone provides the needed uterine protection, so you typically wouldn't also need progesterone. On its own, norethindrone does not treat hot flashes or other estrogen deficiency symptoms. It's most effective when used with estrogen. At some point, almost everyone asks me the same question. Okay, but what are the risks? Any medication that affects hormones does come with risks. With Norethindrone, the most common side effects are things like breast tenderness, headaches, bloating, or mood changes. For many women, these are dose-related and often improve as your body adjusts. If something doesn't feel right, that doesn't automatically mean Norethindrone isn't safe for you. It may simply mean the dose or formulation do need to be adjusted. Now, there are situations when Norethindrone simply isn't appropriate. That includes women with a history of estrogen or progesterone sensitive cancers, active liver disease, certain clotting disorders. If any of those apply to you, your doctor may recommend a different approach. When it comes to Norethindrone, it isn't about adding medication without an important purpose. It's about protecting the uterus, balancing estrogen therapy, and making hormone treatment safer overall. I hope you feel more informed about Norethindrone and its role in hormone therapy. Thank you for spending time with me today.